Hello, everybody. Welcome to Medicine and Science on the Pod TV network. My name is Nick Palavita. I'll be your host for today's program. And today we're going to look at a big problem that we're seeing in the United States of America right now. It's the measles outbreak in Texas. Apparently, over 124 people are infected, and it's sending everybody scrambling, because, including the anti-vaxxers who found religion and decided to get vaccinated. So, with that, because we know in the Tower of Power in Washington, D.C., we're now led by a person who has no experience whatsoever in medicine. He's the Honorable RFK, who's a environmental attorney who should resign and appoint somebody who actually knows what they're doing. My prediction: he will not last 6 months in office. So with that, that's a kind of a bold prediction, but we're going to watch to see if he's around there. Not to say he'll resign, which he should do. He'll probably get fired, believe it or not. But with that, let's bring in Dr. Michael Patness, who is a medical doctor. By the way, there's a lot of qualified people out there. They're called medical doctors, and they know about health, and they could lead health and human services. RFK is not one of them. He is an environmental lawyer. Hello? Environmental lawyers have no business in the health department. So with that, I'm going to bring in the Honorable Michael Patness, who is a medical doctor, is board certified in internal medicine, to give us an update on the chaos that's about to be inflicted in the United States of America. So, Dr. Patmos, you can maybe let people know what the heck is going on in your country.
Well, good morning, Nick, and good morning to all the viewers. I apologize for being a little bit late this morning. I'm not in my usual location, and it took me a minute or two to get online. But I always appreciate the opportunity to spend a little time with you and share some thoughts about where we are today with regard to health. Yes, I am a board certified internal medicine physician. I also have added qualifications in infection control and hospital epidemiology. We are in a crisis mode right now. Measles is surging throughout Texas and also in other parts of the country. Now, this is getting a lot of media attention because measles kills roughly one in every 1,000 people who get it. And for those who survive measles, which is most people, many will be left with after effects. That can include severe neurological complications, a disorder called subacute sclerosing panencephalitis, which is a permanent neurological damage which can result from measles. So it's very alarming that measles is spreading and that there's so many cases now in Texas. The important points about this measles outbreak are: one, it was completely preventable. Measles is completely preventable. No one should get measles anymore. But as it is what it is. We have well over 100 children now, or people with measles, mostly children, in Texas. The other thing, of course, is that the reason this measles outbreak has happened in Texas is because of plummeting and declining vaccination rates, especially in Texas, as well as in other states. That has happened because physicians, some of whom are licensed in Texas, have been spreading incorrect information to the public about vaccination, which is a violation of the Texas Medical Practice Act. I am a licensed physician in Texas and in 13 other states as well, and I know the Medical Practice Act in Texas. It is illegal for a Texas licensed physician to share incorrect information with his patients, and that's what's happening now. Texas licensed physicians are sharing incorrect information about vaccination. Vaccination rates are declining, and that's what has led to this spread of measles. Now, how did this measles incident in Texas get started? Someone had to bring measles into the state. It didn't pop out of the air or come out of the soil. It was brought in to Texas by someone who was infected with measles, who's then spread it to others. For every single person with measles, they will expose on average about 18 others will get sick. So if you have measles, on average, it's so contagious that you're likely to make 18 other people sick. So 18 people infecting 18 other people each, and you can see the logarithmic nature of the spread. But a point that has not been made in the media, I think I'm the only one to make this point so far, is that measles had to be introduced into Texas sometime in the past few months in order to have this outbreak among largely unvaccinated people. Where could it have come from? It is my speculation that this measles outbreak was initiated, basically started off because of someone from Florida. Florida last fall had a measles outbreak. And if you recall, we did some programs about this. Florida's state, where I'm also licensed, Florida's state Surgeon General defied all of the infectious disease experts and told parents in Florida, if your children are exposed to measles, don't worry about them, let them go to school. No, that is absolutely wrong. Dr. Ladapo was wrong. Any infection doctor will tell you that is wrong information. Nevertheless, that's what he said. That's what happened. And it was demonstrated that people with measles from Florida then planted or transplanted the virus into other southeastern states, including Louisiana and other neighboring states. And I believe that the outbreak in Texas probably stems from spread from Florida and could be laid right at the desk of Dr. Joseph Ladapo. So this problem in Texas now is the fault of Dr. Ladapo and the fault of Texas low vaccination rates prompted by Texas physicians giving out bad information and the failure of the Texas Medical Board to hold doctors accountable for spreading incorrect information. What's likely to happen with this measles? Now, people are scrambling. I'm getting text messages from people saying, hey, should I get a measles booster? You know, measles vaccine gives you 97% protection from infection that is lifelong. But, you know, over many years, some immunity can fade a bit. So a booster is certainly not a bad idea. I had a measles booster just a few years ago. I never had an original measles vaccination because I had measles as a child, so I have natural immunity. But I did have a booster a couple of years ago as a result of policy at the hospital that I worked at the time. So I would recommend that people who, if you don't know if you've been measles vaccinated, get vaccinated. A booster is not a bad idea. But so people are scrambling now to think, gee, what about this vaccine? But it's too late. If you're not vaccinated and you're exposed to measles now, it's going to take a while for that vaccine to take effect. And so at least in the short term, you're at risk. And remember, every person with measles will affect 18 others. So what are we likely to see in Texas and in other parts of the United States? Logarithmic spread of measles. 100 and some cases today, and in a week, it'll probably be upwards of 1,000 cases. And then at some point it will taper down. All of this is completely unnecessary. Why is it happening? It's happening because of the attack on science by the current administration, who is appointing unqualified people, as you mentioned, to be in charge of health. Certainly, we've talked about Robert Kennedy. He's a lawyer, but there's someone else who I think really needs to be called out today. He's currently in the news and about to take over as head of the NIH, and that's Dr. Jay Bhattacharya. Everybody should know Dr. Bhattacharya's credentials. Yes, he's a professor of medicine at Stanford. Yes, he has an MD degree, but he is an economist. People don't understand. An economist can hold a title as professor of medicine. That doesn't make them an expert on medical topics. Dr. Bhattacharya graduated medical school, that is true, but he never did anything after that. No internship, no residency, no fellowship. He's not board certified, not board eligible, has never had hospital privileges, doesn't qualify for hospital privileges, has never had a medical license, doesn't qualify for a medical license, has zero clinical experience, and absolutely unqualified to opine as an expert on any clinical matter. He is an economist and a very well-published one, but that's what his area of expertise is. It's not in medicine. Here's what I am very fearful is the plan. I think this is speculation on my part, but I think here's what we will see. RFK, we know, is anti-vax. What he and so is Dr. Bhattacharya, what they're going to do is they're going to cull through data that they now have access to and try to piece together and spin together. Remember, RFK is a lawyer. He's got other lawyers he works with, like Aaron Siri. And they're going to piece together pieces of data and try to concoct a story, a narrative as follows. Here's my prediction, what RFK will do. He will say, aha, see, we have found evidence buried in the archives, somewhere in the federal government, in the swamp. We found this evidence that proves that vaccines cause autism. See, I was right. And then they'll publish that in the new medical journal that they just created, where Dr. Bhattacharya, I think, is the editor-in-chief. They will publish it now to make it look legitimate. The other thing is RFK is going to replace many members of the advisory committee on immunization practices. He's already fired several prominent people on that committee. He's going to replace them. My prediction is he'll replace them with known anti-vaxxers, like potentially Dr. Peter McCullough, Dr. Robert Malone will end up on the ACIP. I think the ACIP will then take this data and now build it into their recommendations. And what we'll see now is the official internalization and externalization of false information about vaccines becoming the official narrative, becoming the official proclamation from the Advisory Council on Immunization Practices. They're basically stacking the deck against vaccination. I think scientists and physicians who are experts in vaccines and infection control will be marginalized and worse. And I think the country is going to slip further and further into the spread of contagious infectious diseases. And those are my cheerful comments for today. I'm sorry to tell you all of this, but I think this is the situation we find ourselves in. And I think Americans need to be prepared for a greater spread of not only of measles, but also pertussis and other diseases. My advice, get vaccinated. Don't believe them. They don't know what they're talking about.
Yeah, I did look at measles, and I had measles when I was a kid. And what we did is we had to stay inside a room that was completely dark because there's a high propensity to go blind if
Yes.
you get exposed to light. So I think people don't realize how not only contagious this disease is, but it is responsible for death, blindness. As a matter of fact, one stat said there were 140,000 measles deaths in 2018. Well, they weren't in the United States because the United States was vaccinated. Notice the operative word is was. So we're outside the United States in the non-vaccinated countries, but it's a huge number. But the thing is, let's imagine you don't die, then you get the living death of blindness, the living death of brain injury, the living death of you lose your hearing, the living death of 2 years. Apparently you're immune compromised. So what happens, Dr. Patton, is because this has not been around for so long, people become complacent. They go, well, it's not that bad. Well, I can tell you it is that bad, okay? And what we're doing is we're allowing the leadership, and I'm glad you're calling out the leadership. And I did look at your Dr. Bhattacharya, whatever his name is, from Stanford. And you're right, he's never practiced medicine before. In other words, and lawyers can do the same thing, by the way. You can get your law degree, and we have some of them that are on our show, and they never practice law. They've never been in a courtroom. They never filed an appeal. They've never done anything related to law. Okay. Well, apparently you can do the same in medicine. He's got a medical degree. But
There's
looks
a
like
very,
he's never seen a patient. In other words, and so it's ridiculous to have a guy like him. Now, I believe people like him and Dr. Lopato are more dangerous than RFK. RFK is a snake you can see. He is not qualified. He's a lawyer. You might as well make me head of HHS. I don't know what I'm this stuff, but I probably know, oddly enough, I probably know more than he does. But that's still not saying very much. Okay. And what I hate is there are all these qualified people that could take the position, and they've been overlooked for a clown who has no background whatsoever. So I'm going to I will not rest until he resigns, or I think Trump will fire him. I actually think he will not last 6 months or a year. He'll be gone.
I hope you're right.
Not competent.
there's a very important point that I need to make. And you said something, you said that, with law, you can have a law degree
Yeah.
and not practice law. But if you have a law degree, if you just pass the bar, you can practice law. A medical degree is not the equivalent situation. With a medical degree, you can't practice medicine with a medical degree ever. You have to, that's only the halfway point. The medical degree is the halfway point in your medical education. After your medical degree, there's this thing called postgraduate medical education or graduate medical education, which is required in order to practice medicine. An MD degree qualifies you for nothing. It's ornamental. It's the beginning. It's an MD degree is an entry level credential. In order to be a doctor that can practice medicine and get a license, you have to then do postgraduate medical education. And that includes internship and residency at a minimum before you can practice medicine. So Dr. Bhattacharya never completed his medical education. His medical education is incomplete. He's an economist.
Right. He's got a
A
PhD.
little difference between law and medicine.
Yeah. Now, he is going to be head of NIH in the United States. Okay.
Yes.
Now, the reason I say that is that our show gets broadcast all over the world. So, and so the people that are watching, including the people from the World Health Organization who have been watching our show, it's different in other places in the world. They don't really they follow what we're doing over here in the United States. But the thing is, I don't think a lot of them understand what's going on. But you're telling me this guy who has never practiced medicine before is going to be head of NIH. Is that correct, Counselor?
Yes. And there's another point to be made.
Yeah.
The NIH is I think, was the foremost biomedical research enterprise engine in the world. Thousands of researchers, billions of dollars of funded research in areas of biomedical research. Dr. Bhattacharya doesn't have qualifications in that. His research and his publication record, if you look at his bibliography, it's extensive, but it's all in economics and economic policy. It's not in biomedical research. He doesn't have the qualifications and the credentials to read and understand a complex technical paper about nucleic acid genomics of viruses. That's outside his area of expertise. How can he properly evaluate the merits of research that he doesn't have training in? He's an economist. He would be better off in a situation as a Secretary of the Treasury or some economic position. He's not a clinician, and he doesn't have qualifications in bench research or clinical research, bench scientific research or clinical research on medical topics. He's a fish out of water in this role. And he's there for one reason. He's there because there's an effort here to pull the rug out from the scientific community and the medical scientific community and basically bring an end to their goal is to bring an end to vaccination. And if you watch carefully, I will bet you that in a matter of a few months, they will announce that they have found proof. The smoking gun has been found that vaccines cause autism, and they will try very hard to stack the ACIP with anti-vaxxers, pull the rug out from vaccination, and promote an anti-vax agenda for the United States going forward, which will be catastrophic.
Yeah. We were following actually what was going on in the Tower of Power of Washington, D.C. when it came to the confirmation of RFK. There was one senator who voted against him from the Republican side. By the way, all the Democrats voted against him. Yeah. And this senator was, oddly enough, Mitch McConnell. Now, Mitch McConnell is an older senator, and generally he toes the conservative line. But he couldn't stomach a person that was against vaccinations when he had to live through polio. And see, this is something, I don't think the media understands the significance of this. Now, here's what I understand the significance is. It showed us that these senators are spineless because, other than Mitch McConnell has a spine, but the rest of them are spineless, Dr. Patman, because they refuse to stand up with what is right. Instead, they're so scared of Donald Trump and what he might do to them, that they're willing to confirm a person who's totally unqualified for the position. And I'm glad that we are every week going to stay on top of the situation in Washington, D.C., and we're going to report around the world, because remember, the United States, your life expectancy is only like 77 years old. In Spain, it's like 82. And in Japan, it's like 84. Canada, it's 84. So I think you might even see the life expectancy start going down.
It already has.
It already has, yeah. And then it means something to the international community, because we have people all over the world. They're looking, hey, should I move to the United States or not? Well, with the health crisis that's being self-inflicted, maybe not. And number two is that the United States was the leader in health. Are we going to delegate the leadership of health to China or Japan? I mean, seriously, you're going to lose it. And the last thing, I believe Donald Trump lost the election because of COVID-19. He mishandled it. He brought in a bad team, just like he's doing right now. And honestly, that cost him the election, was his handling of COVID-19. He had not a clue what he was doing. It may cost him the midterms, in other words, because if the health situation deteriorates in the United States, you're going to see a bunch of Democrats come in the midterms. And right now they're heading that direction, because they have certainly not brought in the best and the brightest. They brought in two individuals that don't have a clue what they're doing. And I totally object to having an environmental attorney guiding health in the United States. And yes, we have the freedom of speech. Thank you. So we're going to say what we believe in.
Measles is going to spread now, particularly amongst unvaccinated people. And so I think what we could see between now and springtime or summer is, a significant spread of measles now beyond Texas. That may be enough to turn public opinion against him, but there's nothing that we can do until the midterms in November 2026. That's a long time from now, and he can do a lot of damage between now and then. So, but I suspect I would really watch these measles numbers carefully, because I think measles is going to get much worse. It's so desperately contagious. Unless the population. Now, here's what Robert Kennedy should be doing. He should be out there right now on television saying, please get vaccinated. The most important message he could deliver right now is to urge measles vaccination across the country for everybody. That is how we could stop this measles outbreak right now. If everybody is immunized, the outbreak stops. But he's not doing that. He has not come out and said that. In fact, he's talking about other ridiculous things, such as, nothing is off the table, and we're going to take a look at whether or not vaccines cause autism. That's already been studied extensively. They don't. But his goal is to go in there and find something that he can use to claim that they do, so he can say, aha, I was right. So that's what I expect. I am not optimistic. I hope that public opinion turns against him, but I think unfortunately we're stuck until the midterms in 2026. And this is going to be a very busy time for doctors. Certainly with influenza, I predicted that if RFK got in there, we would see a resurgence of infectious diseases. And I said that many times on this podcast, that sure enough, it didn't take very long. He's only been in a month, and we're already seeing an explosion of infectious contagious diseases. Just wait, it's going to get a lot worse. So I hope.
And by the way, when you did mention that, but all this is available on the internet. So the thing is, for people who want to look at how contagious measles is, just Google measles, and you'll see it. It's like incredibly, and don't believe the politicians. Go believe ChatGPT. See what they have to say. But here's another.
If you're a doctor,
stuff. This is like basic science. But here's another basic one. Flu, 65,000 deaths, highest in 15 years.
Yeah.
Okay. How come the greatest country on earth, purportedly, having the best health system on earth, purportedly, has a whopping increase in flu deaths, 65,000? Okay. What's going on here?
I've treated myself, because I still practice medicine. I've treated in the last month about 200 people with influenza. None of them are vaccinated, and so you don't get vaccinated, you're going to get influenza. It's also very contagious, almost as contagious as measles. Let me be very clear: if you're not vaccinated against influenza, you will get influenza. If you're not vaccinated against measles and you're exposed to it, you will get measles. These are contagious diseases. They spread from person to person. So vaccine is the best prevention. What vaccines do is they prevent death and severe disease. That's the goal of vaccination. When people say, well, you can get vaccinated and still catch the thing, well, it's true, but you're going to catch a much milder form of it.
Correct.
The goal of vaccination is to prevent death and severe disease. And vaccines are highly effective for that primary purpose.
Yes, and that's been my experience. In other words, the vaccines, when I do get sick, it's very mild as opposed to when I wasn't taking the vaccines. Because I'm asthmatic, I got seriously ill.
Yeah.
And I don't want to be one of the statistics of the 65,000 people who died in the United States of America because they're not getting vaccinated here. So if you are coming to the U.S., and we're talking about international people, make sure you get a vaccine before you come to the United States, because the person sitting next to you may not and probably will not be vaccinated, and you're going to catch their disease. But we do want to thank Dr. Patmos, who is actually a board-certified physician, for enlightening us what's going on in the medical issues in the United States of America. And we want to thank our viewers in the U.S., the World Health Organization, who is broadcasting or rebroadcasting this, and the people from around the world. And we'll see you next week on Medicine and Science. Take care. Bye-bye.